this is a quite popular nursing home and these guys didn't have all the supporting infrastructure for high-end equipment. So they bought our device, and it's been a year. And the doctor called me and said, "Sir, from last one year, we haven't sent a baby to any other neonatal ICU or any other place because of your device. All premature babies we are able to manage here itself."
Hello everyone, Ashok here. Thank you for tuning in to this second episode of Indian Startup Stories. Today our guest is Nitesh Kumar Jangir, co-founder of Coeolabs, a medical device company solving unmet clinical needs in the field of emergency and critical care. They have developed first in the world innovative solutions addressing unmet clinical problems like ventilator-assisted pneumonia for adults and a very handy neonatal breathing support machine for newborn premature babies, avoiding NICUs. In this episode, Nitesh talks about his background, how it all started, products they create solving critical needs, his experience in understanding the problems in healthcare institutes, the impact that the innovations are bringing in multiple Indian villages and towns, how they got investors before even starting business, interesting facts on registering patents and maintaining it, and much more. So let's jump in. Hi Nitesh, thank you for coming on Indian Startup Stories today. Welcome to the show.
Hi, Ashok, thanks for inviting me. I'm really happy to be here.
My pleasure too. Please tell our audience what you're creating in Coeolabs.
Coeolabs, our focus is on developing new medical devices in the field of emergency and critical care, where we focus on finding unmet clinical needs, specifically for low resource settings, and then we go back and see what kind of technological solution we can develop which can solve these problems which are needed by millions of people in India alone and responsible for hundreds of thousands of lives we are losing because of lack of very curated and good technology here.
Okay, that's definitely is the need of our service in healthcare. How did it all started? The idea of Coeolabs and what was the spark moment?
We planned for it. I have been trained in inventing new medical devices. That's what I was supposed to be doing after completing my education. So I've been trained in a process called biodesign, which is a process of inventing new medical devices by identifying unmet clinical needs. So I spent almost around 2 to 3 months in a hospital's emergency room along with my partner Nachiket and 3 doctors and 1 business specialist, Ram. All of us, we spent 2 months there figuring out what are the most pressing needs the hospital is facing. And then we analyzed all of them, put a lot of scientific data behind it, did a lot of scoring, did a lot of secondary research, and then picked up 2 needs which we really wanted to solve. And that's how, and once we figure out what can be the most optimal solutions to solve these problems, we started Coeolabs.
Okay, that's nice. So when did it all started? Which year and what are the focus areas?
2014. Focus area is critical care, ICUs.
Oh, okay. So what are the main products that you come out of?
Multiple products now. So one of our product is a product which prevents deadly hospital-acquired infection called ventilator-associated pneumonia or ventilator-associated event. So basically, not many people know that if a patient goes on a ventilator, he has a 30% chances that he will die because of a secondary infection or secondary pneumonia that patient gets from being on the ventilator. It happens because we generate close to 2 liters of saliva every day. But what we do, we swallow all of the saliva. But people who are on a ventilator, they have a tube going inside their throat. And because they are on ventilator, and these tubes are going inside the patient, these patients are also heavily sedated. They lose their natural mechanism of swallowing. So all the saliva, which was supposed to go in, either go out of your body by multiple ways, will not go, and slowly it accumulates and trickle down to the lungs. See, as a normal person, if we get any amount of saliva in our throat, we cough it out. That's the cough mechanism is there. But patients who are on ventilator, they cannot do it. The saliva is a really good place for bacteria to grow. So because it's full of glucose and all other nutrients for them. And then slowly it goes inside the lungs and infect them. So assume a patient who's already unable to breathe properly. That's why that person is on ventilator. And above that, they get a lung infection, which damages their lungs again. It's similar situation with COVID. As you guys might be seeing, most patients who are on COVID on ventilator, they have a severe pneumonia. So pneumonia already damaging your lungs. So to solve this problem, we have built a device. We call it VapCare, which automatically
Okay.
senses and remove all the secretions from multiple locations, from mouth, from back of our neck, inside our throat, and all these places, and make sure that none of these infected secretions reaches to the lungs. This same machine also pushes antibacterial, or in COVID, we are seeing people are using antiviral liquid inside the patient's mouth. It rinses the patient's whole oral cavity, takes out again takes out this infected fluid out, and then it ensures that even oral hygiene is maintained. So then the chances of acquiring this deadly infection becomes really, really low. What this whole system does, this system automates this whole process of oral hygiene management and secretion management. So now nurses and doctors also, they don't need to go near to the patient's mouth and manually remove all the saliva and secretion, because especially in infectious disease like COVID, it is really dangerous process. Even WHO has
Yeah.
declared open suctioning as one of the reason COVID might transmit. This is the world's only device which can do all these functions. We have patents granted across the globe. We already got US FDA registration done for this device.
Oh, I guess it plays a very good risk avoidance role, keeping the health workers safe and outside of the infected fluid. That's great. And how long did it take to bring out the product? You got the FDA approvals and stuff.
Yeah, it took us around 5 years to develop it fully.
Okay, so it's well prepared when COVID has hit.
For COVID, actually, we developed another product also, but that was largely related to providing non-invasive ventilation. So that also has became a big hit now.
Okay, how challenging was this bringing out these ventilators? Can you talk about story about, because when COVID started, the world facing challenges because of these ventilators, right?
I think that was all misinformation people have. Uh,
Okay.
I don't know if many people know that with ventilator, 90% of the patients are dying.
Hmm.
So I'm not sure whether people have talked to critical care physicians that do they really need these many ventilators. Now I go to the hospitals, there is oversupply of ventilators, but they don't have. See, it's not about machine. These machines are
Hmm.
complex machine. You need people who are really highly trained who can use these machines. We don't have those people here. So that becomes a bigger challenge than machine. And then when ventilators are the last machine one should use. These are not a machine which can save a lot of people.
Right.
So
In
so
terms of, I mean, using a non-invasive methods before getting into the invasive procedures, right?
yeah, so one have to use non-invasive ventilation only as much as possible. So there are multiple modes available: BiPAP, CPAP, high flow. These are more of clinical terms. So basically, either you increase the pressure or you increase the flow, you increase the amount of oxygen you are giving. Try multiple ways of physics to ensure that patients' oxygen levels are on at acceptable level while clinicians are treating COVID virus.
Okay. In Coeolabs, you're predominantly into the neonatal services as well, along with treating other patients with COVID, especially babies in ICUs, handling the golden moments of their initial days.
Our idea is to be into emergency and critical care, and
Hmm.
then play the role in most critical area. So one big issue which we saw during our time in hospital, that a lot of premature babies born outside hospitals where they have neonatal ICUs. Eh, we are talking about more than
Hmm.
70% of these babies born outside a center where
Hmm.
neonatal ICU is not there. Huh? In
Yeah,
India, we have more than 4 million baby born prematurely. India has, in the world, we have the highest level of prematurity.
that's quite high. Yeah.
Yeah. And and all of most of these premature babies require immediate breathing support because their lungs are not developed. In the hierarchy of this thing, overall pregnancy and delivery, lungs are the last organs to which get fully developed. So if a
Hmm.
baby born premature, their lungs are not properly developed. They are unable to breathe without any support. But all these existing support machines are designed for neonatal ICU. Again, it's not just about the machine, it's about the people who are using them, as well as a lot of supporting infrastructure required to use this machine. So you require compressed gas, compressed oxygen, continuous supply of electricity. You cannot use these machines in transport. These are machines are complex to use, complex to set up. So we looked at this problem, and then we found that more than 162,000 babies every year die because they just don't get access to this machine when they really require it. So that's where we designed this device. We call it Saans. Saans is actually world's only neonatal CPAP machine which can work without electricity, which can work both in hospital as well as in transport. And for us, transport means literally anything. I'm talking about even on motorbike, you can just carry this machine. This machine is just 4 kg. This does not require any supporting infrastructure. Yeah. And it
Okay.
can also work without electricity, as I told you. It has a manual mode in it.
So you're covering both the neonatal for babies as well as COVID patients.
Yeah, the COVID one we started only after COVID. We never thought we'll get into adult non-invasive ventilation market. Uh,
Okay.
but when we looked at this thing, because we were constantly in discussion with senior critical care specialists, and all of them they
Mhm.
said that we require good non-invasive ventilation machines, which were not available in India. Uh, so,
Okay.
that's where we said that okay, we already have the neonatal one. We can use our experience and knowledge to make an adult one. So that's where this thing came, and I'm happy to tell you now we have more than 400 of these machines installed across India. And
Oh,
from our
that's good.
calculation, we are seeing it. These machines have been used on more than 3,500 patients.
Okay, that's good number. Yeah. So lately, due to COVID, I mean, generally dynamics have changed in all the industry, especially in healthcare, right? With lockdown hampering manufacturing of hardware equipment, and you being, I mean, predominantly the hardware equipments, right, for neonatal care or the VapCare stuff. How did you handle the demand and the need fulfillment in this area?
Yeah, I think we were lucky that most of our supply we were able to maintain in India even earlier. So
Hmm.
it was expensive. It took a lot of effort to bring our local suppliers to a level where we can produce a FDA approved device. But then uh, we had suppliers, and because we came into the category of critical or essential supply, and most of our research is also supported by BIRAC, which is a part of DBT government of India. So these guys have helped us. If anything we needed to get from any other country, these guys have helped us to get those that material in. So there was a parallel supply chain happening, especially for essential goods, even during the lockdown. And we were allowed to work full time. Even most of our suppliers were allowed to work full time.
Okay. And can you talk about any specific pride instance, like you being part of your customer journey, be it a hospital or a non-profit organization?
2 months back, actually, we went to a rural, it was not a rural hospital, I would say a semi-urban hospital of government setup where we gave our device for a demo, doctor,
Mhm.
just for a couple of days. And it's been 4 months they haven't gave us this device back because from that day onwards,
Okay.
this device is not without patient.
Okay. And which part of India is it?
It was in Maharashtra.
Okay. Okay.
Economically we were thinking that oh man, we our one device is stuck, but then other way we were really happy that in a place where there was
Yeah.
nothing to
It's
support,
need.
this happened. Another place, even in it was a small nursing home. Now you can see that
Mhm.
that's where these devices were designed for India play a really vital role. A small
Okay.
nursing home in Punjab, again that's a really that is in a place called Pagwara, which is in really small town.
Okay.
And this in this nursing this is a quite popular nursing home where and these guys didn't have all the supporting infrastructure for high-end equipment, so they bought our device, and it's been a year, and the doctor called me and said sir, from last one year we haven't sent a baby to
Hmm.
any other neonatal ICU or any other place. Because of your device, all premature babies we are able to manage here itself.
Oh, that's nice. Yeah.
Yeah.
Relating to your number that you mentioned, like 4 million babies were in need of these kind of devices, right? I guess you mentioned around 3,500 hospitals that.
So 3,500 patient, that's a COVID device. The
Mhm.
neonatal one have been has been used in more than 1,000 patients by now.
Okay.
And all of this happened during we have launched our devices around a year back only. And because of
Okay.
COVID, our neonatal and other products got suffered little bit.
Okay.
But then even after that, we are seeing this kind of impact and use case.
Right, right. COVID has actually pushed every industries to think differently, right? And especially for you, it should have brought in quite a lot of changes as an individual and you, and also for your business, right? Can you highlight on some of the execution and how you manage scaling your product? Because now need is actually surging on everyday basis.
Actually, now most products related which are related to COVID, I would say they have been already oversupplied. So what we are seeing in our industry for next 10 years, there won't be any hospital buying ventilators.
Okay.
There won't be supply of monitors. I mean, many of these critical care equipment has been oversupplied. So now we have to think even more differently to figure out now
Mhm.
what value we can bring on. The one thing which we realized, we understood a lot of on ground realities. So, and
Mhm.
then we realized that most 99% of our Indian products are or products which are in India, medical devices are copy products, and those do not work in these local settings. So now we are building a lot of automation, lot of intelligence into the devices, so it reduces dependency on skilled workers. Because this
Okay.
is the biggest challenge we have seen. We have not seen the biggest challenge as an infrastructure, but the biggest challenge we have seen is highly trained people. So idea is to make our solutions foolproof. That
Okay.
a patient, if he requires non-invasive ventilation, a doctor should go switch on our device, or even not even a doctor. Technician should go and switch on our device, and they should forget. But it should still be able to provide all that ICU care, ICU level non-invasive ventilation care.
Right. So it's completely developed in India, or
Yes, yes. Our products, all our products are fully developed in India.
that's nice. So what's the reason behind the name Koyo? Just curious.
Oh, this means coming together. Our team is quite interdisciplinary. So we have doctors, engineers, business specialists, product designers, public health specialists. All of us work together to ensure the best product gets delivered.
Nice. Nitesh, for any employee who starts thinking about entrepreneurship, right? There is always this question of how will I manage my transition from employee to entrepreneur? There must be challenges like family, finance, commitment, and the friction of getting into unknown zones, right? So, how smooth was your transition? How smooth, or was it rough?
It wasn't rough at all. I think it's all about the mental situation. It's where and where you come from. See, I come
Mhm.
from a village, and where we used to eat what some onion chapati and with curd all the day, and we used to be happy. so
So,
it's all about how you adjust your needs
okay.
and the financial needs, and then you set up accordingly. I think I remember one of my professors told me this interesting line. He said it's very fancy thing for all the people to use that entrepreneurs are these takers and all this. He said all the good entrepreneurs never took any risk. They're saying they
Okay.
always managed a risk. So it's not about how big that risk is. It's all about how well you have planned for that risk, and how well managed that risk is. He's saying the real job of an entrepreneur is managing risks. It's not his
Mm.
job is not taking unnecessary risk. He has to figure out everything. Means randomly don't go and take risk without any thought, without any plans, and figuring out what you are going to how you are going to mitigate this thing.
Yeah, nice. You're putting it so simply. I'm sure, like you might have had many initial nightmare days, right, in any entrepreneur
Yeah,
journey. Like,
that even
can you
I
talk
have.
about
Even every day we have.
any specific instances who helped you and how you handled it?
Entrepreneur is again a fancy name, but running a
Mm.
business is a proper
Right, right.
name. All these generation of people are running businesses in India. The it's almost everyone helps you. And
Mm.
what I find that I was lucky to have really really good mentors,
Okay.
and even friends who worked for me in free. I still
Hmm.
haven't paid them. So, but that is a kind of debt you can never pay. So, that. But then having a good network, good friends, mentors who have done these things before, and what I found, especially in India, people are keen to help.
Hmm.
Where and they don't ask it for return. I've seen outside India, even people when they say they are helping, you will find after sometimes they asking for some financial return. But that's okay. There's nothing wrong with it. But I've seen in India you won't find that common. In
Yeah,
India,
and
you'll
as you,
find really, really successful entrepreneurs, successful people ready to help other entrepreneurs just without any getting any financial return out of it.
good one, good one. So
Yeah.
initially you managed with the F&F funding, friends and families funding.
No, the industry. I mean, you cannot bootstrap. You have
Hmm.
to spend millions of dollars before you reach to a place where you can launch these products. So
Yeah,
either you
yeah.
have that kind of money, or you have to raise money. There is
Right,
no
right.
second way. The only good thing about working in an industry like ours, which is relevant to social entrepreneurship, as well as high tech side. So you can actually get a lot of money from foundations and as well as research agencies. Like we got a lot of financial support from Department of Biotechnology through BIRAC.
Okay.
So they have been quite instrumental in our journey, and not just in our journey. They have helped hundreds of companies.
Okay. I can see within your 2 years of your inception, you managed bring in funding from startup accelerators like Mars Challenge and all these things. That's
Yeah,
a very very quick turnaround time you managed to pull it through. So how did you manage initially before you even had any minimal viable product before reaching to the investors, right? How was those period handled?
this was interesting. We actually secured our investor first before
Hmm.
even we started thinking about the company.
Surprising. Okay. How did you manage?
Investor in Excel. It was an incubator. Now, actually, even we have merged with in Excel only. So, in Excel
Okay.
was an incubator, and there's in Excel CEO Siraj uh, told us that he will fund my 3 months of this clinical immersion. And if
Hmm.
something comes out, if something comes out and their investor committee and everyone likes the idea as well as see a good potential, they would fund it. Yeah, so that's why I told my journey wasn't. I never had a journey. I don't
So,
have food or I don't have to food. It was always somebody who was ready to fund what I was doing.
oh, that's nice. So you
Yeah,
don't have a pre and post situation because you already had your investor secured.
yeah, yeah.
Are you a man of plan B? Like, what if this approach hasn't worked out? Did you have any alternatives?
No, I always had an alternative. So that's what, as I told you, we do risk management. In risk management, I just did a small risk assessment that, okay, what if it fails? Uh,
Hmm.
like, okay, I'm getting paid through my investors' money. So it's not that
Okay,
I'm losing on salary. I'm getting paid very little, but then that's fine. I'm
okay,
getting my experience, and what the worst case scenario? I can again go back and join, but now I can join at quite senior level. I can become co-founder of any if there's a company which is working fine. I can join any startup at senior level. There, so
okay.
now the things have been changed. Now, instead of
Mm-hmm.
joining some other company as a senior engineer, which if I would have gone for my normal role, or
Yeah.
most probably a team leader, now I can
Hmm.
join places at a vice president or director or that level. So so that's the worst case scenario. Like worst case, what will happen? I'll join another company. Doesn't matter.
Yeah, and
So there's nothing to lose here.
yeah,
Yeah.
now you're able to position it differently.
Yeah.
So because you already had this investor secured before even you started the business, how was that interaction initially? Like, what were the demands, and how did investors expected from you? Were there any kind of a weird situation, like this is the expectation that you were not ready for, or was it a smooth one, as you just mentioned? Any weird experiences?
Actually, no.
Okay.
Yeah. I think it's all about whether you in your journey or in your life, how
Mm.
what you would really like to focus on negative things or on positive things. Huh? My focus is always been on positive things.
Okay.
See, investors
That's
are investors. They would want their returns back. They would have a complex agreement to be signed. But
mm,
that's if I'm an investor, I would do the same.
yeah,
Correct.
yeah,
If I
got
put
it.
myself in, I would like to secure my capital because it's their hard-earned money. So they would do what they're supposed to do, and my job is what I'm supposed to be doing. I supposed to be developing these products, taking them to market, making this company or this division successful. So that's my job.
Mm.
So I focused on my job, they focus on their job. So I think this is how it works out. If you start complaining about your investors, it doesn't benefit anyone.
Yeah, yeah. Can you talk about your first success moment? I mean, the first moment of relief after starting Coeolabs, initial days.
I think when we first tested our product on a patient, and
Mm.
when it worked out really well, doctors across not just India but even the top physicians outside India, they really like the product. They looked at the benefit of these products. I think that's might have achieved something which worked well. So now, as I told you, now all these incidents where we see a lot of patients demand for our device, doctors demand for our device. They fight with their management to use our product because they see a great value in it. I think around 2 years back we started seeing all these action happening.
Okay. When should an entrepreneur start thinking on sales and marketing?
Oh, day one.
Okay. And should it be part of the same entrepreneur team, or that should be kept aside for the marketing and sales team as a separate?
No, I think if you don't sell by yourself, your sales team will make fool of you. They will
Mm.
think that this guy doesn't understand because they won't see. As a person, I spent 5 years with my product. I built those relationship with clinicians. I built those relationship with hospital management, which even if you hire a sales guy, even quite senior sales guy, they won't have immediately. They You need to guide them initially. You
Mm.
need to show them how to sell this product. Once they understand this process, then they can use their natural sales instinct. They can use their existing network if they are quite senior people. But then initial few sales, we have to show them how to do it.
Okay, that's good. And what keeps you motivated on your day?
The only motivation is this only, that whatever we are doing is not just financially it makes sense, but then also the kind of impact it makes on people's life. I still remember even 3 weeks back I was in a hospital where a patient was fighting for our device because they had only two of our device, and they put it on one patient. When they were trying to remove it, that guy started shouting or something that no, put that device on. So,
Mm.
so when you see this kind of thing, we capture these kind of moments, we share it within our team, and then people get sense of purpose, not just a financial purpose. Because again, all I say all other industry which are focused on social, I think edtech and healthcare is an industry where even a lot of financial return is there.
Mm-hmm.
So
Was it
you,
because there were no enough ventilators? You were mentioning, I mean, we were having quite a lot of, I mean, we already meeting the demands, but when people are fighting.
those are invasive ventilators.
Mm-hmm.
What we are talking about is non-invasive ventilators which can deliver air oxygen at really, really high flow with full
Okay.
blending.
Mm.
So those kind of things were not available then. Now we have 3 4 companies in India which are doing this. Along with that, we also developed a new interface. See, it's quite easy to see patients on TV and these things, but when you
Mm.
sit on their place, for example, if you are receiving non-invasive ventilation through a mask, huh,
Mm.
it's such a painful thing. Nobody
Yeah.
is able to tolerate that mask for more than 4 5 hours because it's bulky, and more than bulky, it seals on your patient's nose tightly, and
Mm.
it and you will see a lot of marks on their nose and other thing. So we looked at this problem, and during COVID only we developed our own interface, which is like a helmet,
Hmm.
which covers the patient's head, and then it pressurizes the air inside that helmet only. So
Yeah.
and so it's quite comfortable for the patient. So there are these small innovations we did, which where we make sure that being working a lot very closely with doctors, we understand these problems or usability issues really well, and then we design solutions which can fit aptly to that.
Yeah. So how do you stay calm during your days of this chaos? You hear a lot of instances in hospital, and you need to immediately take care of those things, be it your equipment or product.
I think I found a trick. I usually I walk a lot, and then when I walk, I call my friends randomly, and then I just talk to them. I do all the bitching to them, and then yeah, then it calms your mind in. Like I think it's all about telling someone what is inside you. And
Yeah.
I'm fortunate of having a lot of friends who are who understand that I'm going to waste their time at least for half an hour or 1 hour, but they are okay with it.
Yeah. So for people going through failures, what's your message from your experience in order to lift them up?
So that's a situation. But for day-to-day failure, this is only personally what I do. I think about the worst case scenario, what worst can happen, and then I'm okay with that worst case scenario. So even if
Okay.
failure happens, that as I told you that what can happen worst in failure, I can again go back and join somewhere else.
Yeah. I
Yeah,
guess pretty early you started in as an entrepreneur, and what is the one important quality that you expect that any budding entrepreneur should have?
I think the most important thing is about passion for the problem which we are solving. I think that's the most important thing, and uh, on field, real good understanding of that problem. So that's the most important thing. I see lot of people, and then they fail quite easily. In 6 months, 1 year, they go back. The
Hmm.
main reason behind it, what I see, they read it on news, or they do some internet research and find something interesting, or see something done in US, Europe, and then they try to do same thing in India.
Mm-hmm.
And many times it doesn't work because they don't understand the problem of Indian customers.
Yeah. So the quality time in understanding the problem is important.
I remember again my professor teaching me this thing. His motto was that if you understand problem really well, solution
Hmm.
becomes obvious to you.
Right, right. And your suggestion to young people having big ideas but afraid to begin with.
Yeah, they don't need to afraid means what to lose. Just look at again as I told you, like what they are going to lose on. Means if
Yeah.
it works out, then it works out. It doesn't work out, then nothing. If you have those skills, if you trust
Hmm.
on yourself that you are a person with some skill set which other people are going or other organizations are going to value, you don't need to afraid.
So take it forward and keep working on it. That's the only mantra.
Yeah.
So let's talk about something that can happen wrong. In your experience and perspective, what are the generic things that could go wrong with an entrepreneur, be it in business or in personal?
Yeah, and I think there are lot of factors, and then it changes a lot with time. For example, an industry like ours, which is a regulated industry, so the way regulation changes, the way government policy changes uh, can make and break a product. Can You might need to invest a lot on your regulatory approvals. Think a lot about patents. And I think the one of the biggest mistake even I did that early on, that we always miscalculate the amount of budget will go into multiple things. For
Hmm.
example, say patents and IP protection. We always think, okay, it might cost you 5 6 lakhs or so, but it actually costed more than a crore to secure IP across the globe, and then managing it costs annually. It costs us 20 to 25 lakh rupees annually just to manage those IP.
Yeah, there are quite a lot of amount spent only in patents maintenance.
So these kind of costs usually we don't consider them properly, and when they come up, they hit us hard. So doing the proper projection and understanding the cost really well, and one can do this by talking to existing people who are into this in similar industry. They can guide you that what kind of budget you should keep for what. Either it is sales, marketing, even design and development, and all these
Mhm.
activities they have to figure out uh, the real cost comes in, because there are a lot of hidden costs which we are not aware of.
So how big is your team, Nitesh? Be it a co-founder, the initial teams, or
So now we have been merged with my investors company called InnAccel. So
Mhm.
with combined team, we are 32 people.
Yeah, that's still a small number, but you're doing good job impacting multiple life.
Yeah, because we don't do manufacturing. My 32 member team, all of them are R&D people.
Okay.
So all manufacturing and everything we have outsourced it.
What's your vision for India in 5 years down the line in healthcare?
In India, a lot of healthcare is moving outside hospital. Almost 50% of the healthcare delivery might happen outside hospitals using telemedicine. So that would
Okay.
become really big in India, and we might become self-sufficient in at least most generic medical devices.
Okay. So, what do you foresee the products coming out in telemedicine that will really make everyone starts using it?
No, I think most people who could have used telemedicine products, they have already started using it. Yeah, using those, and those products are already in market.
Yeah. For the consultation, of course, yes.
Yeah. Even for the devices, a lot of devices, for example, you can get now wireless ECG, you can get wireless physiological parameter monitors, even wireless stethoscope, so which can connect to the internet. You can get the data from away. With this merger, now we have a product which can actually you can do the telemonitoring or telemedicine side of. You can monitor fetal heart rate, which is a baby inside the mother's womb.
Mm.
You can actually monitor the heart rate of that baby wirelessly, uh, sitting somewhere else, get this data on cloud. Uh, especially a lot of monitoring is happening on cloud. I'd say still, but physical treatment would require a doctor's presence over there. So that's why I said
Mm.
that 50%, which is the monitoring part, would definitely would go on the telemedicine, but
Okay.
then real intervention would still be through doctors physically being there.
Yeah. So, how current generation startups, in your opinion, would adopt and play a big role in changing the ecosystem of well-established field of healthcare?
I think startups have already started playing a big role in delivering healthcare in India, because what I've realized, hospitals do not have anything for big companies. Means if you provide, they are always looking for quality solutions at lower cost. So if you can provide them a CT scan machine which is as good as GE CT scan machine, but at say 50% of the cost, they would go with you. They won't even think about it. Means either it is into
Great.
patient monitoring or even into the ventilation market. Now a lot of Indian companies are there, and then they are doing pretty good.
Okay. So coming to the end of the show, I have a rapid fire round and I've listed down some questions.
Shoot them on.
So one global leader you follow
I follow Bill Gates a lot.
and the book that you are currently reading.
Oh, I'm reading Obama's memoir.
Okay, nice.
Yeah,
One crazy childhood activity you still wanted to do.
I still read comics.
Interesting. Given a superpower for one day, what power do you ask for?
I think mostly time travel.
Okay. Which wish tops your bucket list?
I think the same thing of getting a superpower.
You're merging my questions. So one skill that you are learning now to upskill yourself.
I'm learning a lot about supply chain management.
Okay. So, your one liner advice for school or college students who dream to be an entrepreneur.
Don't be entrepreneur first. Work in industry for some time and get some real life skills, at least for a couple of years, to understand what really happens in a professional environment. I think then I would say that's the best way to get into startups.
Yeah, getting to know the ground.
And also you make really good good connects with your managers. You make a really good network in the company, which is more with professional people. So that can help a lot in the journey which you are planning
Hmm.
to take further.
Okay. One thing about you that you want people to remember you for.
Nature of happy to go lucky. It's like this guy is most of the time happy.
Your favorite subject in school?
It's hands down it's physics.
What's your favorite social media platform that daily you follow?
Like, I use LinkedIn a lot.
Nice. That's good. And thank you so much for your time, Nitesh. It was wonderful talking to you.
Yeah, Shok, same here, man.
Thank you. Okay, we are at the end of episode number 2. Thank you very much, Nitesh, for coming on and sharing the insights. And to our listeners, you can find out the episode summary in the description. Until we catch up soon, stay tuned, be motivated. Thank you.